So hello everybody, this is Natalia Marmol, co-founder of Nevia Health. If this is the first time that you are watching us, please know that you can find more videos in our channel. All of them talking about autism from the medical perspective. Today, I have the great pleasure to welcome two very special doctors that I had the enormous pleasure to meet a few years ago when they invited us to Serbia to see the amazing work that they are doing with the autistic community. So welcome Dr. Maric and welcome Dr. Dijan. How are you doing today?
Very well, thank you, Natalia. How are you?
I'm very good, thank you. I'm very happy to have you here. So I'm going to just say a few things about you two, and then I'm going to ask you to please introduce yourself. So Dr. Maric, he is an MD and PhD orthopedic surgeon and pediatric surgeon. Dr. Avazovic, he's an emergency medicine specialist. So please, would you mind introducing yourself a little bit further?
Jihan, would you talk first or me? Should I say a few words?
I think that, Professor, you are a little bit older, so
yes, just 16 to 26 years. Okay. Well, I'm a surgeon, basically. I have two specializations. I finished my medical school in Serbia, Novi Sad, University of Novi Sad. And I'm dealing with regenerative medicine together with Dr. Avazovic at last 10 years. We are both founders of Society for Regenerative Medicine of Serbia and founders of South European Society of Regenerative Medicine, and we are co-founders and co-presidents. And also I'm chairing Orthopedic Regenerative Society of Serbia. Also, we found and I'm chairing subject in medical faculty regenerative medicine, and last 6 years we are teaching our students about regenerative medicine and potential of regenerative medicine in everyday practice. It means that in every field of medicine there is possibility for regenerative medicine. So this is our focus, and Jihan is much younger and he can explain maybe our focus today. We tried and we succeeded in basically in start for orthopedics, and we developed few new techniques about cartilage reconstruction and transplantation, PRP, different types of therapies and so on. So we are very experienced in regenerative therapies in orthopedics, and 5 years ago we started in a field of neuroregeneration, and then we also start to help our colleagues in treatment for autism that maybe is very interesting for you. This is for an introduction.
Thank you, Dr. Maric.
Yes, thank you, Natalia, first of all, for inviting us and giving us the opportunity to share our experience with wider auditorium. My name is Jihan Abazovic. Yes, I'm an emergency medicine specialist, but I also have a master's study in molecular biology. And I try somehow to combine both of these things since that I have pretty useful skills in the technical working, especially in traumatology. And from a molecular based perspective, I think that I'm pretty good in the lab. So this is why I decide to use this maybe unconnected two fields to start working in field of regenerative medicine. Regenerative medicine is something what is, and where we are using, actually this is a multidisciplinary approach where we are using
we are having some problems
cell parts in order to improve treatment in every today field of medicine. As Professor Maric already mentioned, we start working in orthopedic field, which is more closer to us, but since that we have pretty great results, we start to get more people involved, specialists involved in our team, and we continue working in neurodegenerative diseases. Then we continue working in gynecology and obstetrics. Now we are developing a new program for trying to treat diabetes type 1, and this brings us that today we have a few accepted protocols, especially for using of autologous component in helping in neurodegenerative disease worldwide. And our team now have here in Serbia more than 40 people, and we have of course our colleagues all around the world which are supporting us, and I can say that today we are a team which numbered more than 200 experts in the fields.
Okay, so that is a lot of information in just a few seconds. So tell us, how did you start working with autism? What was your first approach to treating autism or treating the symptoms of autism?
Should I answer or Jihan?
Whoever prefers.
Should I start and you will continue then?
Yes, please.
Okay. We did a lot of patients with a cerebral palsy. Cerebral palsy patients. Basically, in cerebral palsy patients, we have a very distinctive cause of disease. It is perioperative or intrapartal hemorrhage in the brain. It causes forming of scar. Those patients have motor problem and cognitive problems. We have a pretty decent series of cerebral palsy patients done with our protocol with stem cells. It is polyclonal therapy. We will explain it afterwards. And we concluded that in our patients with cerebral palsy, many patients had very significant cognitive improvement. So in cooperation with our colleagues from psychology faculty and the other defectologists, I don't know, maybe it's speech therapy in English, speech therapist, we tried to help them so in some way to have better effects on speech therapy after stem cell treatment. Our protocol with cognitive improvement consists in giving it is called polyclonal therapy. It means that there is no one clone of stem cell that can cure something. There is always combination of stromal or stem cells. We use bone marrow stem cells and stromal cells, that they are working all together in order to recover something. Basically, in autism, we will try to restore three things. Primary thing is a reconstruction of axis between cerebrum, brain, and gut innervation that is dearranged. Then to sublime or to correct immunological response of glia cells in the brain. And the third is activation of polymodal synapses in order to have better communication and to reconnect autistic childhood to analyze data in a frontal or occipital range of brain. It means that each type, for example, mesenchymal stem cell, certain phenotype can control glial exposure, the other can control permeability of membrane between gut and subcutis nerve system. For example,
Maric, sorry to interrupt. Could you bring the camera, because your hand is right in front of the camera? Stable.
Okay. Perfect. And then the hematopoietic stem cells can make activation of polymodal synapses. There's a three basic axes that we try to correct. And so far we have very decent results in a cognitive improvement in cerebral palsy, but also in an autistic patient. Of course, it's not primary treatment of autism, but just additional therapy to the other therapies that are officially used in everyday world in the treatment of autism. So this is how we started.
Okay, so thank you, Professor Maric. I think that I will put it a little bit less scientific way, and I will start from the beginning. So first ideas we have in 2012 about this kind of therapies. Actually, what we want is to approach the neurons as much as we can. And since that cells can't, from the blood, they can't come to the brain, actually, to cerebrospinal fluid, we bring out the idea that we should directly inject the cells in cerebrospinal fluid. It took us almost 3 years. So in December 2015, after doing certain researches according to our regulation, our local country regulation, we get the approval to use this approach as a safe approach for trying, actually for treatment of, first of all, we try it in spinal cord injuries. Then after that, we saw that this kind of improvement, which is more cognitive, and we show it to these kids with cerebral palsy, as Professor Maric explained. And then we say why we shouldn't, and in the meantime, we find some parameters which are actually showing us that with this approach of the therapy, we are really pushing the cells, actually neural cells, in some let's say working. So they start producing some signal protein, etc., which we can measure. And when we did this measurements, we show actually we kind of proved to, at least to ourselves, that this can be really connected with the cognitive functions, and we actually proved our theory that this is some kind of immunological, I will say, blocking of the cells. So then we got an idea with our colleagues, which are treating directly these patients, actually autistic patients, to try this as it was already approved as a safe therapy. So to try this in patients which are autistic patients, and we show pretty. Actually, our first results were even for ourselves very, very amazing. So we continue to deal with this. What I would like to underline on this point is that this is not really the treatment of the autism itself. We are just helping the improving of the symptoms. And what we, since that we have, I think, one case study and one case report already published, and we are now preparing the big study, which should contain, I think, 67 patients, which we have 2 years follow-up. What we saw in this actually patients is that if you are going through some speech therapy and other ways of well-known treatment of the autistic kids, something what you can achieve with same protocol for 4 years, with that same protocol, but with our therapy, you can achieve in I'm not 100% sure, but 1.4 or 1.5 year. So this is actually the basic idea. This gives the patients two opportunities. First is to the development to be, let's say, faster. And second, very important thing is that it brings us to the position that they can work more and more, and they will be, in the end, if we measure when they are adults, for instance, 18 years or something, in the end, they will have probably have, we didn't prove it still, but probably they will have higher grade of improvement in every, almost every disorder from autistic spectrum.
Okay, now can we put it, can we go back a little bit? So if you were to tell right now a family that you have in front of you and they want to understand in a basic way, what is the treatment? What would the kid go through? Can you explain it, please?
Yes, I will try, Professor, now first. Sorry for this. So the main idea is that how actually the process goes. So the main point is that this procedure is considered as a minimal invasive and as a very safe procedure for the patient. Of course, procedure is done in total anesthesia, and it takes all the risks which are risk of total or actually general anesthesia, and it have a risk of infection as every wound will have. So these are the major risks which are in total all in all very, very low. Since that we are talking about autologous therapy also for some kind of reaction on what we are giving to the patient, this is amazing to happen since that we are not adding anything on the cell, we are just separating the cell from the patient own. So these are few very important things to underline. And then how the procedure is going, actually we are we are putting, after the checkups, regular checkups, we are putting the kid in the general anesthesia. We are making one very small cut above the hip, let's say, in the bone called crista iliaca, and we are making very small cut, which is less than 1 centimeter cut, when we are placing this special needle, and through this needle we are taking the bone marrow. The volume of bone marrow depends on the patient's weight, and we are calculating it on site. But let's say that for kid which is, let's say, 25-30 kilos, we are taking somewhere between 100 and 120-30 milliliters of bone marrow. From that we are separating all kind of nucleated cells, including the all stem cells, in the small portion which is between 1 and 1.4 milliliters in the end, and we are injecting this as an intrathecal injection. Intrathecal means that we are injecting it with a very thin needle, placing it in the cerebrospinal fluid, and this process is process same like the women's getting the epidural anesthesia for delivery. All process takes all in all around 45 minutes up to 1 hour. It depends how time we spend to put the kid in sleep and to wake it up. But during all this period of time, we have two actually active parts. First active parts take around 10 minutes, and this is harvesting of bone marrow. And second active part, which is happened in the same operating theater, of course, as the same procedure, is after around half hour after separation of the cells, is giving this intrathecal injection. Afterwards, we are placing the kid in intensive care unit, and then from intensive care unit, let's say, after in and out, when we take the kids and when we bring it back to the parents, shouldn't take longer than 1.5 hours, just in specific cases, because this is medicine, we can't elicitate with that. And for our conscience, the kid is staying in the hospital that night just to check that everything will be okay, and next morning, if everything is fine, we are discharging the kids. And this is what happened in 99% of the patients. One of the maybe more common question is, would the kid have any pain or something in the place when we harvest the bone or we give the injection? Absolutely no. So it may happen to autistic. Absolutely no. I'm saying for a regular procedure, but if we technically have some difficulties, we explain it to parents, and we are telling them that they should give them some analgesics or something. But this is very rare situation. But when we are talking about autistic patient, they have a problem because they have this bandage on the bone, which makes them some kind of discomfort, and this is why they are looking or that, and you know, have something new, but this is absolutely not pain.
Okay.
Painful.
Do you when you harvest the stem cells, do you do anything to them?
Officially or unofficially?
As you wish to explain.
Officially, we are not manipulating the cells.
Okay. So the same product that you get from the patient comes back to the patient, just
yes,
separated.
Yes.
yes. Exactly.
Actually, I would not say that we are not manipulating, but this is considered as minimal manipulation. So we are using just simple centrifugation in order to obtain the end product. So this is actually it about substrate.
Okay, so can you tell me something? Have you ever considered any other type of procedure? So you're doing intrathecal. Why did you choose this way of giving the cells back?
Should I
can try answer to this. So this is very during the research process, which is not so easy thing to do, and we can go through it during the research problem. During the research which we did, we find out that this may not be the best possible substrate which we can prepare for our patient. But in other side, this is the sorry, is everything okay? Can you hear me?
Yeah, is everything fine?
Sorry, because I have some noise. This is, maybe we in the lab we can make a better substrate, theoretically better, which can maybe give us even better results. But we are now dealing with something which is best possible what we can do to be absolutely safe for the patient. And this is something which is following certain regulation in order to approve us to do this kind of therapies as let's say certified therapy according our regulation. I mean, certified, this therapy is, not to have some misunderstanding, this therapy is not certified as a therapy for helping the autistic kids, but it's certified as a safe therapy to use in this approach. And now we are showing if it's going to have an effect and how big effect will be. And we are very optimistic about that.
So tell me something, what should a family expect to see on their children after having had the treatment?
This is very difficult question because they are not two same kids from the autistic spectrum. But what we can say in the general, we are doing certain scoring before doing the procedure. Mm-hmm. And through the certain time, we are repeating same scoring. So this is done by our colleagues, so I'm not so familiar with that, but as I know, there are 5 types of scoring. Mm-hmm. And we have improvement.
But the main is GARS.
Okay, we have improvement in 3 of these 5 scoring systems in more than 70% of the kids after 9 months period. Why 9 months period? Because usually we are using 3 procedures every month, and then we are calculating 6 months from the last procedure.
Sorry, let me just clarify that. So your treatment consists of 3 procedures. How far apart from each other?
1 month.
1 month apart. Okay.
Yes.
So isn't
so
that...
as we like to say, 3 procedures in 100 days.
I see. Would that be a little bit too much for a child to undergo the 3 procedures?
No, there is a certain reason of having 3 procedures.
So what is that reason? What can you tell us?
Cumulative effect of those mechanisms that we explained at the beginning are last much longer than just after one treatment. And if we have, we should have continuous treatment of speech, for example, we presume that our effect of our therapy can last even more than half a year. That's why we are estimating the success of treatment at least after the first 6 months. It is not just giving one cell or one type of cells, but the systematically driven influence to the 3 axes of treatment for autism.
Have you seen any, one thing that is known is that some children in the autistic spectrum have some issues with anesthetics. So have you seen problems derived from that general anesthetic?
I just kind of, there was 2 basic anesthetics, one of the based on soya, and most of the patients that are allergic to soya have some inconvenience or incompatibility to soya products. They are not advised to get Severan or Profadicide. I don't remember now, but we combine both of anesthetics according to the information of the patient. So each treatment, we can call it personalized. So Jihan can explain it more fluently and more emotionally than I, but it is the key that there is no the 2 identical patients. So we are changing the anesthetics according to the patient.
Okay. And what I can add to this, that our team of anesthesiologists which are working with the kids are all of them are pediatric anesthesiologists. Yes. So we didn't have any severe, let's say, problem. Of course, there are some minor things which are happening in our everyday practice and which we can't avoid. But when we actually we have 2 ways of personalizing the therapy especially for the kids. One way is that we are personalizing the therapy according to the disease or disorder which kid have. So it's not same if it have cerebral palsy or some other condition or autistic kids. And the second way of personalization is that we are discussing with parents, looking all of the tests which they did, and if we saw that there is something which could be better or something which we should avoid or something like that, we are also in this way personalizing the anesthesia, and we really don't have any kind of problem with this.
Okay, so just to go back a little bit, because I don't think we've mentioned. So your facility is in Serbia. It's nearby, let's say 40 minutes from Belgrade, if I don't remember wrong. So yes. Last time when I was there, you had a hospital, but now I know you have a brand new hospital, even bigger, even better. So what can you tell us of your new facility?
Not just one hospital.
Okay. What was our aim since that when we start to do the procedure, which was long time ago, we use the facilities which are best possible for certain indication, and not just facility but also people working there. So this is how we divide the teams which did specific thing in specific facility. And since that these are pretty new things and they are sometimes very demanding also for the staff, our idea was not to change the facility and not to change personnel, so for certain indication. And as we grow with different indication, and as we involve more people in our team, I mean, when the COVID starts, we have an idea to put everything under one roof, not just for having better care for our patients, but also to have something when we can put all the data together and to get a better everyday better treatment for them.
Okay, good. So now can I ask you to explain a little bit. Besides stem cells, I know that you offer other treatments for autism. So I know that you have your, hyperbaric chamber, that you offer other treatments, that you are even now considering FMT, which is microbiome transplant therapy. So can you tell us a little bit more, how is that going, and then go back to the other therapies that you do?
During time we see the necessity for involving more people which are dealing with this kind of pathology, and today we are proud that we have the team which is working with the kids in meaning of all kind of speech therapy and other psychological testing therapies and etc. etc. Also, we have a hyperbaric chamber which we are using for our patient. Yes, we are now in the preparing of starting, because we started now as a research for fecal transfer, and also what we are now preparing, maybe it will be next year, is something what will be connected with kind of gene therapy, because we have a theory that something which is when we are talking about autism, one of the problem may be the methylation of DNA. So not to get so much in details, but this is let's say our past, not past, but our developing goes from the really basic and everyday using practice and clinical experience. Then we build up with this stem cell therapy. Now we are including fecal transfer, and hopefully in the year or two we will have some type of gene therapy.
Yes, gene
and
therapy.
Then after that we don't know, we will see.
Can I ask you to go a little, just a tiny, give a little bit more detail about the genetic therapy, just a little bit more, not to.
But I will miss the cake.
I think that this is in the very early stage, so we are not professionally we are obligated not to talk about that. But as I give you an intro, we have some idea what possibly could happen in genetic side to kids which shows actually
involvement of
autism,
gene directly.
Yes, so and we are now trying to build up the technology which can interfere in this system. So I can't tell you more than this.
Okay,
yes,
fine.
it means that
we will have to do it another time. But just to wrap up, because I know that we're short on time. So let's say if a family comes and see you at your facilities in Novi Sad, just tell me, what can they do for their children there? We know that they can have stem cells. They can have also hyperbaric chamber. Is that right?
Yes.
What else can they have?
They can have all kind of speech therapies and working psychological therapy, but this is in the agreement with us, because for this kid which are coming from abroad, it's very difficult to work on this kind of therapy, since that they have the language barrier, and there are some papers showing that even if you are not from same dialect, it's much more dialect part. It's much more difficult to work with that kid. So this is something what we offer, but this is more for the kids which are from our region, actually from our speech area. And for people who are coming from abroad, we are always. How we like to do it, we make the first appointment, and also we are allowing the parents to go through all experience to see, not of course in operating theater, but to see how everything works, and to meet, for instance, our patient and so on. And to bring the decision according that, except the part which we are professionally saying. And I mean, the Novi Sad is very nice city, as you have chance to meet it. So and it's Belgrade. It's pretty great connected with the flights. Of course, I'm not counting this time of Corona, but it's I think that a lot of people doesn't have special opportunity to come and visit this part of the world. So everyone is very welcome, and we will show first of all our hospitality, and afterwards our professionality without any obligation in any moment. And we really want to give as much as possible relevant information for specific case in order for parents to bring the decision according pretty exact information, whatever it is.
Perfect. So the other thing I just wanted to mention is that for the Spanish community that they are watching right now, Dr. Maric, he lived for a while in Spain, so he can speak Spanish. So he is actually very keen on speaking Spanish, I know. And so whoever wants to get in contact with him and with his team, so to know that he can speak that Spanish, and that he will be happy to help the families. So thank you very much. I know you're very busy. I know Dr. Maric needs to attend an event right now, so he needs to go. Dr. Maric, I think I mute your microphone now. I don't know. Can you unmute it now? Okay. So anyway, thank you very much for being here. Thank you very much for
you're welcome.
Explaining what you do in your practice, and yeah, thank you for this time, both of you.
Thank you
Natalia,
for inviting us. Thank you.
Thank you.
No, thank you. I mean, it's always
Take
a pleasure
care.
to see you. You too.
Take care. You
Both
can choose one bolero by your own choice afterwards.
I will put it on your honor. Anyway, take care and hope to see you soon.
Don't bet on it. Okay.
Yeah.
Bye.
Okay,
thank you very much.
Bye.
Thank you very much, and bye, Natalia.
Bye, doctors. Take care.
Take care.